Big savings on a dental procedure is one of the top reasons why people choose to travel to other countries. In the same time, before taking this decision, we may have a lot of questions. Why prices there are much lower than in my country? How many trips do I need? Are there any guarantees? Let me help you to get the answers. I'm Julia from GloboMD, the service that connects you with the right doctor worldwide. And today I'll ask our partner, a dentist from Mexico with 20 years of experience, Dr. Oscar Alcaraz, to tell us what he knows. Dr. Oscar, I'm Julia, responsible for communication in GloboMD, and I'm so happy to see you. Doctor, can you tell us a little bit about your professional background, your studies, how many years you are working as a dentist?
Sure. Well, I'm Mexican. I'm in Cancun, Mexico now. I've studied in Mexico City University. It's called UNAM. I've been working with teeth like for 20 years. So I've seen a lot of products come and go, a lot of techniques, a lot of specialists work with me. So I got 20-year experience.
Awesome, doctor. So today I have for you 10 frequently asked questions. They are from our patients. So these are people who come to GloboMD. They need to fix their teeth, and yes, we are matching them with the right doctor and negotiate like the good quote for them. So some people would like to save more money on dental implants. That's why dental clinics abroad, such as you are in Mexico, is a good option, because it's like up to 60–70% of savings. So when we propose such an option, many of our clients immediately ask why prices in Mexico are lower than in US.
Okay, first and the quicker answer is that about taxes. Taxes in US are higher than in Mexico.
Taxes.
Then taxes first, taxes. Then here in Mexico, we can use a lot of world products. It's different in US because US just use US products. We can use European products, Korean products, I mean, products from all around the world. So, but talking in general, in every kind of dentistry, we use European, US made, and from all over the world. So that's why dentistry made in Mexico is cheaper than in US.
Okay, awesome. Second question. What are the risks and benefits of dental implants?
Risk and benefits. Okay, benefits, you can get your full mouth restoration in just a couple of appointments. So if you got any really big issues, or your mouth is completely destroyed or lost one or several pieces, you can get them done and get fixed inside your mouth. And the risks, well, you got every risk like in every surgery. You can get really swollen or got, I mean, we always ask our patients to get, we make them some question. If you got diabetes, you got high blood pressure,
to prevent.
Exactly. So that kind of issues or disease increase the risk of not having your proper, that they don't work properly, your implants work properly in your mouth. But if you are okay, or you got your diabetes control, your high blood pressure control, you can be a nice and good patient to get your implants done. But let me make a little emphasis in this thing, is that not all patients implants, they're their only way to get their teeth fixed. We got a lot of different kind of treatments, that they are not as, how can I tell you, those big, or got a lot of treatments in their mouth that can get their teeth done. So no problem. We got a lot of different kind of treatments.
Okay, one of very, very famous treatments, it's all-on-4 and
Yes.
all-on-6. Can you please explain what is all-on-4 and all-on-6 implants?
Okay, all-in-4 means that you got all your mouth fixed on 4 implants, and all-in-6 with 6 implants. The difference between one and the other, of course, is the price, the number of implants, and the possibility that you may have different kind of materials to do the full restoration. The thing is that if you got 6 implants, you can get more aesthetic teeth in your mouth. You can get zircon, you can get porcelain, you can get a lot of things that they weigh more than resin, that it's placed with different kind of implants or with 4 or maybe 2.
Okay, doctor, who is it best for? All-on-4 and all-on-6?
It full depends of the case of every patient. Like I told you before, all-in-4, we can play with materials, but I always recommend not to have these really heavy materials in all-in-4. I prefer the all-in-6 to give more heavy materials. I mean, heavy in their weight. It's safer for the patient.
Okay, so it's okay for a patient of 30 years old, 40, 50, this is...
Yeah, but here is the thing. Like I told you before, it really has we really have to plan it, because if patient has a really weak bone, or he has diabetes, or I don't know, maybe a high risk disease, I strongly recommend another kind of treatment. But generally, if patient is okay is healthy, he can get or she can get an all-in-4 or all-in-6 full mouth restoration.
Okay, and you started to talk about materials. What are the materials used?
Used high aesthetic restorative resin and porcelain and zircon. Zircon, I don't know how they used to know them there. It's like how is this? I don't know. I can't remember the name that you use there, but it's really heavy. I prefer porcelain.
Why?
It's a long-term material. It's not that heavy, and it looks really nice.
Okay, if I'm your patient and
Yes.
I need to fix my teeth, how many trips do I need from start to finish?
Well, let's just in the case of the implants, you need 2 trips.
Let's say 3 trips.
2 trips. Two trips. 2 trips. Yes. In different kind of materials. I mean, if the patient needs another kind of treatment, maybe a full mouth porcelain restoration using their own teeth. If I can use their own teeth, they just need 1 trip and no surgery involved. That's another kind of treatment, and people can get the same results on all-in-4 or all-in-6 treatment using their own teeth.
Okay, it's like first trip and months later a second trip, or
2 or 3 months trip.
2 or 3 months.
Yeah, because of the implant has to get really stuck into the bone and be sure that it's okay to get the full restoration on it.
Got it. And how do I know if my dental implant is healing correctly?
You won't feel any pain. You will feel like just a small thing that it wasn't there before, but you won't feel any more pain than in a regular dental extraction. Okay. I mean, the pain is going to be lower and lower and lower every time.
Yeah, less pain is always better.
Yeah, of course.
Doctor, what guarantee do you provide for the patients?
It's 100% warranted around the implants. Now that we are talking about the implants, always the houses that they give us the implants. I mean, every kind of implant give me the 100% warranty around the implants.
Okay, doctor. That's an interesting question, not about dental job, but what celebrities have dental implants? They all have such a beautiful smiles.
Well, that's an interesting question, because let me tell you something. Most of the celebrities, they done not as full of implants. I mean, I'm sure that they got maybe 1 or 2 got implants, while the other ones got veneers. Let me tell you, Nicolas Cage it's an example. Really? You can see Nicolas Cage at the long of the years, and he's been changing his teeth. Jim Carrey.
I never noticed. Like, he always has such a big smile.
Yeah, but he's always changing his teeth, and I can notice because I can notice.
Yeah. Okay, and doctor. So after doing all these treatments, can you eat an apple with dental implants?
Yes.
And
Yes, yes, yes.
your teeth will remain in your mouth or on the apple?
No, 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 in your mouth, in your mouth. Even if they're not fixed, using another treatment, because let's explain this thing. I'll try to make it really, really concrete. We can get, we've been talking about the all-in-4 and all-in-6 treatment with implants. There, the full restoration is going to be fixed into your mouth. Okay, it's going to be screwed into your mouth, into your implants, into your jaw. Okay, it won't come up, so you're not going to be able to eat an apple. Well, in the other hand, we can get some implants with a snap-on denture in it. That it's a couple of implants that they support a resin-made denture, and you can eat apples with them too. I know it's going to be a little more difficult because the snap-on denture, it's going to be for removal just once in the day to clean it up, but you can eat an apple with that too. So the answer is with implants, you can eat an apple with the all-in-4, all-in-6, or with snap-on dentures.
Okay, awesome. Thank you very much, doctor, for your answers.
Thank you.